But what we see in India is that schools are filled with ambitions, aspirations. So what is the role of a teacher in a student's life has to be understood by a parent as well as a teacher. Do you think there are kids who are not intelligent who are studying in smaller schools or even downtrodden schools? Language or the knowledge or a school doesn't determine who you are. How long is the parent, how long is the kid going to be at home? Imagine the level of IQ, level of understanding the kid is going to have. So these things are very much lacking in current society or the situation. Exercise is another word which we have to use with caution when it comes to kids. Because they eat, all they think about is what should I study next. There's no harm in eating a pizza or a burger or French fries once in a while. But it cannot be a regular day-to-day activity.
Hi, Dr. Bagya. So, super excited about the topic that we have chosen to speak about today. I really want to speak about adolescent health. I myself have a teenager, and I think it is very important to address the growing concerns among parents and the growing number of diseases that we see among younger children today. I would like to start with, telling you an example of my niece who is 14 years old and at this age has been diagnosed with insulin resistance. So, I just want to understand what are the common trends you are observing today and what are your views on adolescent health?
Generally, talking about adolescent health, we could extend it to, say, children and adolescent health. Like the change happens when they are kids, or even to say when they are even small infants, the change of insulin resistance, or be it attention deficit, or be it hyperactivity, all these things amounts to problems what present generation children are facing. More specifically, insulin resistance, I would attribute the insulin resistance to the amount of stress the kids have in terms of school, peer pressure, or identity crisis. For instance, if the most commonest is with parents, I would say. Everybody wants their kid to perform in studies or perform in arts or perform in sports. But the performance in every field is difficult for every kid. It's not the same thing we see in a class of 50 children. Not everyone is good at math, not everyone is good at science. But some kids are good at certain subjects, some kids are good at sports. It is the responsibility of the parents as well as the teachers to identify which field the kid is actually interested in. Education is important, but education is not everything. It's not that everybody should become doctors, everybody should become lawyers or engineers or professionals. Everything is a profession. Professional improvement or enhancement does not lie on the children's intelligence. Intelligence is different from what they succeed in life. Personally, I'm saying the amount of knowledge you gain is not equivalent to the amount of intelligence you have or the amount of success you face in life. If that is the case, then every businessman who has not even completed school or school dropouts are big multimillionaires. And people who had got A's in all their classes and everyone are still mediocre professionals. So the success is not defined by how much you know, how much knowledge you have, how much degree you have. The success is known by how humane you are. I'm not saying human, but humane. So it is the responsibility of of the teachers as well as their parents to not to push their aims and aspirations onto their kids. And there is the childhood period is a very happy period of a human being, because that's when they are very playful, that's when they are very joyful, they meet new people, their brain develops, they come into different emotions, connections, they have friends, they have enemies, they have fights, they have chit chats, they go for games. So it should be a very playful environment rather than a stressful environment. But nowadays what I see is everybody is pushing their kids to get good grades, to get NEETs, to pass NEET or to GREs or TOEFLs or all the aptitude tests. But that is not something which you push on a teenage kid who is around 11, 12 years old. This is the time we also call crossroads. I think everybody knows what are crossroads. Every human has a crossroad. Like adolescent is a crossroad. Puberty is a crossroad for females. Marriage is a crossroad. Pregnancy is a crossroad. So all these crossroads are very, very transition phases. So these transition phases has to be very peaceful, very happy, and at the maximum stress-free. So what did you expect from a 10-year-old child? The child is going to be playful. It's going to watch cartoons, or it's going to watch TVs, or it's going to play with your parents, mothers, fathers, grandmothers. the more importance you give is to their mental health rather than their grades or their marks or their performance at school. The second important thing with teachers in general, I'm saying, is do not compare kids based on their grades, be it parents as well as neighbors, peer pressures, friends. It's not the grades which quantify you, it's how well you are as a human is going to quantify in the future. So it is not important if everybody gets an A and not being human, and everybody gets C and D and being human. So who will you want in the future? Who will you want this nation to be? Who will be want this environment to be filled with? You don't want criminals who have all A's, and you don't want non-human people or non-peaceful people with all A's and A pluses. So we want a society which has everyone in it, which has everybody, to make it a good environment. So the most important thing what I tell you is understand your kids. Knowledge about what your kid is going through is important. Talk to them every day. Talk to them as a friend. Talk to them as a playmate. Talk to them as a classmate. Ask how the school went on, what happened in the school. And do not jump into conclusions. I see it very often even in my households or my friends' households. Like if a teacher scolds a student, then the mother gets violent or the father gets violent. They go back to the school, shout at the teacher. They even repent the teacher. So what is the role of a teacher in a student's life has to be understood by a parent as well as a teacher. The most of the time the kid spends is at school rather than with the parents. So the teacher's responsibility is to take this kid as a good citizen, as a good human being. So they have to teach more importance of being a good person, being a responsible person, or being a compassionate person, rather than talking more about grades. So you see this, we talk about schools in Netherlands, we talk about schools in the UK, Australia, where kids are allowed to play till they are 6 years, 7 years. They are all different schools, different places. But what we see in India is that schools are filled with ambitions, aspirations, where every other kid is thinking about clearing NEET at a very early age, becoming a doctor, clearing JE to become a good engineer. But that's not important for a kid who is around in the 5th standard or 6th standard or 5th grade or 6th grade. 5th grade, 6th grade is a transition period. A, B, C, D or 1, 2, 3, 4 are just numbers or alphabets which you can read it at any time in your life. But the importance of being as a kid, the childhood memories are being rusted and they are covered by all these ambitions and emotions. So it's the duty of every parent to teach their kid how to survive in an environment like this. It doesn't matter. You have to tell them it doesn't matter. You tried your best. You've given all your strength. You have given whatever you are able to give. Grades doesn't make you who you are. What you makes what you are. So this importance, this knowledge has to be given to the kid at a very early age. And playfulness is the one and only developmental activity every child will have. So if the child is playing, if the child is naughty, if the child is doing things which is not making you at ease, you become a child. You go and think in his shoes or in her shoes, and then you play with them. And that's when you can create a bond. This bonding is not going to end here. This bonding between a kid, you becoming a father or a mother is not by choice, but it was by a chance. So you were a via media to bring in a life into this world. That's it. You don't have any responsibility over the kid. You don't have any responsibility over its future. I also see a great trend where people want to put their kids on in a school which is well known in the society, which is big, which is already having so many credentials to it. But do you think there are kids who are not intelligent who are studying in smaller schools or even downtrodden schools? Intelligence is not marked by which school you study in. Maybe your grading or your presentations may be different when you go out and say, I studied in a school like this. But I have seen so many of my classmates who come from Tamil medium, who come from government schools, who are splendid doctors even today. I still remember a girl who even struggled to read English sentences when we were in first year of med school. Now she's a fantastic doctor. She has so many patients. She has so many credibilities to her. So the language or the knowledge or a school doesn't determine who you are. Your intelligence and way of bringing tells you who you are. Now I see a lot of difference between parenting and pampering a child. So what is parenting, what is pampering is what has to be understood by a parent. Because I see parents who were kids, say about 20 years ago or 30 years ago, are now parents. The mistake what your mom and dad did to you is what you're going to do to your son or daughter. So you should evolve from that childhood. I see most of the people who are young parents now has not yet evolved from that parenting yet. So parenting is what is parenting. I'll give you an example. Like I told a girl who came to me for a problem with her ovaries, a very small girl who's 13 years old. She's not getting her periods regular. Her mother wants me to send for a scan and to find out what is wrong with her ovaries. I said she has just attained puberty. Why don't you wait for a month or a year to see how she is responding? No, she's telling, no, this has to be proper. So she has to go for tuitions, she has to go for maths, she's studying for NEET, she's doing this, she's doing that. And what are you going to achieve by putting this girl in so much of stress? When I asked her, is she doing the household works? Like, is she helping you in the kitchen? Is she doing the dishes? Is she cleaning the floors? Is she putting a bed back? She's telling, I have maids for all these things. My daughter, she has to only study. This is not the way of parenting. A parent is a person who has to guide the child in doing all these things. All these small things, the way you keep the house is how well you're going to keep your environment or the country. For instance, if helping your mother in a day-to-day chores like doing the dishes and cleaning the floors, or helping her when she washes the clothes, putting it for drying, all these small things puts you in a conscience of family, conscience of
Develops
environment,
empathy and respect for the effort that goes
exactly. It not only makes you a better human being, but it also evolves you as a responsible person. This is what is more important than studying. See, gold medals, yes, everybody gets gold medal. It's not a big deal. You sit together for a while, you study properly, you'll get a gold medal. But gold medal is going to be there on your shelf for a long time. Nobody is going to come to you seeing what grade you got or how much ranks you got. But everybody is going to come to you as a human being. So every parent should actually teach this to their kids so that you get a good bonding. The bonding between parents are not there. How long is the kid going to be at home? Imagine the kid goes at about 8:30 in the morning to the school, and you put the kid in a different, very well-known school, which is around 20 kilometers from where you live, and the kid has to leave the school by 7 o'clock in the morning, and then it reaches 8:30, and then it starts the classes, and then takes 1.5 hours to come back to your house, and then you send her for tuitions, you send her for dance classes, singing classes. How much time you're going to spend with your kid? And then obviously about 9 o'clock you feed her, she goes to sleep. The quality time spent with your kid is more valuable than the amount of time she spends in the school or she spends in studying things. And the other common growing trend which I see is grandparents. When you don't have grandparents for your kids, you're making a big mistake. This can be a very bold statement. This can be outrageous for some people. This can be unacceptable for some people, but I don't care. Grandparents have seen so much of life, what we have seen, much more than what anybody else who is alive has seen. So their 60 years of experience is going to put this kid in a much better position than how we are. If my grandmother or my grandfather had taught me so many things, I would have been a much better human being by now. Imagine if my parents teach my kid of whatever they have gone through. Imagine the amount of knowledge about the environment, amount of sense where the environment is, where the government is going, where people are going. Imagine the level of IQ, level of understanding the kid is going to have. So these things are very much lacking in current society or the situation. This brings a big toll on kids. Imagine about 20, 30 years ago when everybody lived together. The mother scolds the kid. Where will the kid go? It will run to her grandmother, grandfather, and then they'll pamper it. If they take care of them, the mother can be stricter. The father can be much more stricter and then can organize people together. The grandmother is going to teach her how to cook. Even the son, there's no difference between male and female or boy child or girl child. Everybody should know how to cook. Everybody should know how to clean the house. Everybody should know how to do every day-to-day activities. These are the main things what parents have to do. Imagine going out for tours, taking your kids to malls, taking your kids to big fancy restaurants or outings or tours, foreign trips is not going to make them memories. They are going to do all these things at some point of time in their life. The sense of oneness, the sense of neighborhood, when kids go in together and play, how many kids do go to neighbor's house and play together? I still remember I could walk into my friend's house when I was 10 years old. I can go into the kitchen, open the fridge, eat whatever I want, be with there, sleep in his house, sleep in his bed. He can come into my house and do the same thing. But nowadays, are we strong enough as parents to let our kids go into another kid's home without their permission? I can totally say this is not the reality what is happening. So this kind of sense of togetherness, of friendship should actually bond much more in every kid so that they become a better human being.
Doctor, so there is this trend that I observe, especially among Indian parents, where although we teach our children that it's important to eat 3 times a day, we do not teach them that it is important to exercise 2 hours a day, because I see a lot of Western kids. It is mandatory for them to be outdoors. However, Indian children are taught to be indoors. And I wonder if that was the reason why my niece developed insulin resistance at such a young age.
Insulin resistance, like you said, because even though we talk about all these things, the insulin resistance, what exercise is another word which we have to use with caution when it comes to kids. When we talk about exercise, people think that they have to go to the gym, they have to join classes, get a trainer. No. The best exercise what you can give a kid is to go and play outside. The outdoor activities, be it football, be it volleyball, or any sports or anything for that matter. They go outside, play with their peers, play with their friends, they join together. That's when the insulin resistance actually reduces. It's not that the hunger and the time of eating is totally different. Even for kids, it's true that if you're hungry, you eat. If you're not hungry, you don't eat. You don't force a kid to eat 3 times a day.
That is a very big problem, because I see especially young parents have an obsessive need to finish one bowl of rice and dal, even if the child is choking and vomiting. I have seen this in front of my eyes like so many times.
That is because if you eat so much of rice and dal, if you're going out and playing all in the evening, that's okay. That's a different story. Anyway, you're going to be hungry again, and then the kid eats and sleeps. That is okay. But if you're not letting a kid out, if the kid is not playing, and if you keep feeding them 3 times a day or 4 times a day, you feed them stomach full, then you're going to have a problem. It's going to be metabolic syndrome, we call it as, or it's going to be insulin resistance, or it can even be pre-diabetes.
And this also forces the child to develop an unhealthy relationship with food.
Exactly. The food, like I said, is not something which has to be taught before eating. Would you remember days when you went to school? Would you drink the water which is there in the tape when in the school, or do you carry water bottles with you?
I would drink it straight from the tap.
We did the same thing. We went in cycles. We used to play. Whenever we get a chance, whenever we get a free period, all we did is we ran out to the ground. We played with whoever played. We didn't care. They were seniors, they were juniors. We get a ball, we played in the ground. We were thirsty, we went and drank the water there. We were sweating. We didn't have any towels to wipe off. We just wiped it off with hands, and then we lived a life. We didn't have sunscreens to go to school. We didn't have anything extra to make ourselves pleasant when we went to school. This is a lifestyle which is lacking today. That is why insulin resistance is a very common problem with kids. Because they eat, all they think about is, what should I study next? What should I do next? And then they go back home and they sit, they study, or they watch TVs, they play video games, and then they eat again. So all the calories are binding up into the body and nothing is burnt off to produce energy. So insulin resistance is an inevitable process in the kid's life nowadays.
And obesity has become so common among children around the world. I think obesity in young children has become an endemic today.
It is directly proportional to the amount of food you eat and the amount of calories you burn. If you don't burn the calories, your food stays here and then it puts on as weight. And the other important thing what we do is the fast food. The fast food, I'm not against all these fried items or fast foods. They are all substances which you can eat once in a while. There's no harm in eating a pizza or a burger or French fries once in a while. But it cannot be a regular day-to-day activity. The other important issue is what food to like we say, what food to eat. When you go out to a restaurant, how often do you go to a restaurant? How often do you go to a mall? How often you go outing? It's become mandatory that once you go out, you have to eat something. Now the outlets have become so much that it brings in a craving to every individual. It is more a palatable craving than a visual craving. So we see it, we would be happy if we could have what it is. And the palate, when you put a fried item, or when you put a high sugar, high calorie food onto your mouth, then you become more craved or more inclined to again doing it again and again. So the parent is an important role in cutting down these habits and bringing out more an outdoor or a more a physical habit. When you say exercise or physical activity, it should be very keenly watched. That I see a lot of teenagers, a lot of young kids who go into the gym at a very early age and then do weights to increase their muscles, which is again a bad trend. Until about 20-25, I would say you become more cardio, you become more physical, like running, jogging, swimming, all these kind of physically more demanding activities has to be done. The weight training and other things have to come a little later in life, if you have to divide it. But I would say exercise has to have all together. But kids, it's more of games, playing, rather than exercise.
Doctor, are there any tips that you can give, or certain trends that a parent or a teacher can observe when they can identify that yes, this is a time you need to intervene with the child and the child needs help? Because one another trend that I'm observing is that labeling. Parents are very quick, or so society has become very quick to label a child as ADHD, or opting to go for psychiatric help, when it could be just an adolescent change or a hormonal change. So what can parents and teachers do?
Psychiatric evaluation or psychiatric evaluation is not per se wrong when it comes to kids, because we might sometimes demonize a psychiatrist and say that, oh no, it's too much to go on to see a psychiatrist. But it's not a stigma, but it's required. I would generally say the most important understanding of a kid and a parent is priority. The parents should have or should give more priority to the kid rather than to their profession. Nowadays, everybody are working professionals. Everybody are equally qualified. When it comes to mother, when it comes to the father, they are so busy in developing their career, bringing in more money, bringing in comfort to the kid. But they tend to forget that their presence, mere presence for the kid is more important than your money or your comfort for the kid. I'll tell you what trend which can actually bring in a good change in your kid is, you should make them understand that you are there for them, be it the father or the mother. If both of them could create that sense of being there, that's a fantastic childhood. Imagine if the father is busy, then it's the responsibility of the mother to prove that she is there at all time whenever the kid needs. Be it a boy, be it a girl. We see this trend. Girls are more attached towards the father, sons are more attached to the mother. But whoever it is, the kid should have a sense of protection or a sense of hanger where they could go back to their dad or they could go back to their mother if there is a problem or if there is an issue, be it anything. The most important times which you have to be there for your kid is the crossroads which I told you. If your small kid is going to school for the first time, you have to be there. You have to be there when the baby comes out of the school. You are the only person the kid for about 3 years have seen, isn't it? From the time of the birth till it went to the school all alone, it was the mother or the father was the only person who the kid has seen. So imagine you're putting the kid into an environment with completely strangers everywhere, teachers, bound to time, bound by rules. The moment the school bell rings, the kid would run back to the mother or the father. This sense is nothing but the happiness it has to see its own. So you should be there for every time when the kid wants you. The crossroad is first when you put your kid to school. When it transforms into an adolescent, where from childhood around 10 years, and this next is about puberty. and the other is about when they are about to go to college, or when they are about 19, 20 years. These are the most important timelines in a child's life, where they need some emotional and physical or conscious support. This support should be parents and nobody else. Nobody else can give this parenting. Nobody else, uncles, aunties, nobody else can give this other than the parents. So this point, if the child knows that whatever happens to me at any point of life, I can go back to my dad, I can go to my mother, the childhood's life is fantastic. ADHDs, attention deficits, why does an attention deficit comes? When you're not giving attention, the deficit comes back. Okay? I'm not saying if there's a physical cause, yes. If there's an emotional cause, yes. If autism, if there is Down syndrome, if there are chromosomal abnormalities, yes, I accept all these things. But apparently normal child who had a fantastic childhood till 3-4 years, it goes to school, comes back, it starts getting more ADHD, more attention deficit, or more autistic, then it's because it doesn't have that hanger or shoulder to come and lean back on. So it's the parents should be there, should prioritize. The priority should be, even if it has to hang in a balance, be one side the profession and the other side the kid, I would say leave your profession and think about your children. If both of you are working together, prioritize who is going to leave the profession and who is going to take care of the kid. You are not just making feeding, and you're not giving dresses, you're not giving shelter to your children. You are the source of knowledge, you are the source of consciousness, you are the source of sensefulness for that kid. So it is you who have to prioritize, and you have to make the kid know that you are prioritizing him over your profession. So that's when you have a fantastic child and you'll have a fantastic parenthood.
Another common problem I observe is parents who try to impose a certain lifestyle choices on their children in order to fulfill their desires of their perceived success.
Yes, that is absurd. That is why I say absurd is, like I previously said, you were just an instrument to bring that life into this world. You are nowhere connected to the growth of that child. You are nowhere connected to the profession. He or she is destined to do something else. He or she need not do or live your dream. If you were not able to become a doctor, it is not necessary that you have to make your kid to become a doctor. It is the responsibility or the desire of the kid to become whatever it wants, whoever it wants. It can tomorrow go and say, I don't want to study. I know everything. I just wanted to start a business. If that is right for the kid, if that is what the kid is destined, you have to do that. If you force them into something which they don't want, then you're actually creating a larger turmoil than doing good to them. You might think good today, but I have seen so many people who didn't even want to become a doctor, but they have become doctors, and I know how much hell they go through every day in their profession, in their personal life. So every kid has their own destiny and their purpose. As a parent, you have to guide them so that they reach their destiny. It is not their responsibility to fulfill your dreams. It is your responsibility to fulfill your dreams. There is still time even for you. Even if you're 40 years, there's still time for you. If you want to perceive something, you go and do it. You don't push it on your children. The children can do whatever they want to, and it is your responsibility. I'll give you an example. If a kid comes back and tells you that he wants to study literature, can any of the audience who are parents now would be very happy to say that, yeah, you can go and do literature? Even if half of them say yes, 75% of them inside would say, no, it is better if he goes to a professional course. But do you think literature is a bad subject or literature is a bad profession? No. It is your responsibility could be this. You can tell them the pros and cons of being a literary graduate, or you can say pros and cons of being another profession, or you can say this is good, this is bad, this is good, this is bad. But the decision is going to be his choice or her choice. So you should respect the decision so that the kid has a peaceful transition. So this is why, like most of the people now think that, and the other important thing about society and peer pressure. My friend's son cleared NEET, so you should study for NEET. My friend's daughter, she went to the US for higher studies, and you have to go to the US for higher studies. Does it mean that whoever went to UK or US for higher studies are very intelligent and they are out of the world individuals, and whoever did their post graduations in India are not equally important? It's not about the degree what you get. It's not about the knowledge what you gain. It's about the understanding of what you're going to do. You can even study astrophysics or theoretical astrophysics, and you can be a fantastic person in NASA or ISRO for that matter. If a person working in NASA, if he or she sees the person who is working in ISRO down, then the problem is with the person who is looking at it. It's not the place where you work or study is going to determine you. It's the knowledge which you gain in your subject is going to determine you. So this understanding should be there with the parents. And even with the teachers, I'm saying. Teachers play a very major role in the life of every kid, is because they have to tune them. They have to tell them how the society works. They have to tell them how the world works, what is happening to them. Instead of pushing everyone to say you have to get good marks, you have to get A's, you have to get B's, it is the responsibility of the teacher to find out why you got a B rather than a A. If that is corrected, then every childhood is going to be pleasant.
At what point should a teacher or a parent seek help for a child?
Yeah. These are the basic changes what happens in every kid. If you're able to identify a change which is not corrected by all these corrective measures, like giving proper parenting, being for the kid, teacher is able to give more attention. In spite of all these things, if the kid is still suffering from problems like autisms or learning disabilities or dyslexias or problems with attention deficits or depression, all these kind of psychological, I wouldn't say psychiatric disorders, or psychological problems, and that's when you need help. But to define whether you need help or not, there's no harm in going and talk to a doctor and say, this is what is happening. Do you think we need medical attention, or is it okay if we can make some changes in life? This decision again lies between you and the doctor. So how well you interact with the doctor, how well you present the symptoms to the doctor will be able to tell you whether you need medical attention or you need changes in your lifestyle.
These factors that you're talking about, stress and lifestyle, inability to manage lifestyle, is this a cause for early puberty in children, or that's just a completely purely diet based thing today?
No, we cannot outrightly say it's because of diet or it's because of emotions, but it's a blend of both together. The early puberty is attributed to certain diets, which does cause problems of bringing up more hormones, more estrogens and progesterone, so that it matures the uterus and the ovaries to bring in puberty much earlier. At the same time, the emotional changes are taking a toll on the hormones. Hormones are nothing but they're all made of proteins and fats and cholesterol. So what happens is these protein hormones are all interconnected. So if we say start from the pituitary, hypothalamus, thalamus is just on top of it, then the pituitary, thyroids, your pancreas, your uterus, ovaries, male testis, all these things are central line hormones. So we call them as central line. When there is a dearrangement in one, there is already an impact which is shown to the other hormone. They are all endocrine hormones which are not regulated by ducts. There is no way of connecting the hormones to the blood. So they are all working through receptors. The receptors are nothing but receptors are like kind of understanding each other. I don't see you, you don't see me, but we all work on the same wavelength. So you understand me, I understand you. So it's kind of mutual understanding where there is no physical contact. So what happens? The hormones come in place into the blood, and all these things are reversed by a mechanism called negative feedback. So like we do a blood investigation, the body does checking of bloods every now and then. For instance, thyroid, if there is more T3 and more T4, and it gives an information back to the pituitary saying thyroid is already secreting more, and then so it reduces the stimulating hormone, so it is asking the thyroid to reduce less. And then when this is done again, then it goes back and asks the thyroid to secrete more T3 and T4. So this is kind of negative feedback, holds good for all the hormones. And all these hormones are interconnected imaginably, which means if there is a problem in the uterus, in the luteinizing hormone or the follicle stimulating hormone, the progesterone and estrogen is going to take time. When there is no follicle to nourish, then there is no need of luteinizing hormone. When the follicle is not breaking and the egg is not coming into the endometrium, then the endometrium need not prepare for the next cycle. Need not prepare for the next process, which is pregnancy. If the endometrium shreds, the next cycle has to come from the different ovary. So these things are all interconnected. So it's kind of a chaos, which is an interconnected chaos. If you trigger one hormone, one disability, then it dearranges the whole system. That's when all these insulin resistance comes up, cortisol increases, flight and flight, adrenaline hormones increases, your body is under stress. All these things are secondary effects of it. But what creates the problem is your mental state in which the kid or in which the person is in.
And this doesn't happen in a period of 6 months to 1 year, right? Like if my 14-year-old niece is diagnosed with insulin resistance, what is the window up to which this may have started, this trauma for this child, or this environment, unhealthy ecosystem would have started?
These things can be different for different people. It need not be exactly say about 6 months for everyone. This kid could have gone back say about 1 or 2 years where all these things started and slowly starting to accumulate, or there could be a sudden pressure. Even it can happen in 3 months. Insulin resistance can happen anytime, but it's a binding hormone. It's not. It didn't happen overnight. I mean, you're asking that whether it can happen the day before and then the next day.
Does it happen over a period of 5 years, 5 months, 5 days?
Can be. It can take 5 days. It's not so early. It cannot happen anything less than 6 months or 1 year. At least insulin resistance needs some time. It's a continuous process. It's not something it happens. You throw a stone and then the course of the water changes. No, it doesn't happen like that. It happens in a due course of time. But this period differs for every individual. It can be few years for somebody else. Few years in the sense what determines this is like all these emotions. They might have got out of these emotions for a while. So the insulin resistance didn't pop up so virulently as we see it as a disease. But it started accumulating by one, say about 6 months, 1 year time, and then they presented with insulin resistance. And when we see it as a symptom, I think it's already has done the damage than to prevent it. You know what I mean? Like you see a kid who has put more weight on the waist, they've become obese, they've become very dull, not active, they've got all these skin folds, the darkness in the back of the neck, all their armpits, folds and all these things, stretch marks, the skin tags coming up. They're all very common symptoms what we see in children now.
Stretch marks?
Stretch marks is because putting of overweights, particular areas where the collagen comes in joints and forms a joint, that's where if there is excessive fat accumulation, then there is a small striae of fat striae which comes up and shows it in that point. So these are all showing improper fat metabolism. So the insulin spike happens with every stress move you make. Insulin spike doesn't even happen only with the foods. I tell you, insulin is a hormone which reduces, which gives energy. Insulin is a hormone which converts your glucose into energy. So whenever your body is in need of energy, the insulin is going to act more. So the more you stimulate insulin, the more you're going to deplete insulin. So you're going to become a process or what you call the insulin resistance. The insulin spikes not only comes because of food, mind you. Insulin resistance happens every day, every minute in the mind. If you are stressed, insulin resistance happens. Insulin spikes happens. I mean, glucose spikes happens, insulin resistance automatically comes up. So you have to store your insulin back. That's called, we call it as insulin reserves. So it's more of environmental, dietary, physical and emotional. All four things joins together to form insulin resistance in children. In fact, not only children, not only adolescents, even for adults, it's the same story. It's a diet, it's the physical activity, it's the environment, and it's yourself. All these four factors play a major role in insulin resistance.
Doctor, so hormone imbalance, is it just something which is experienced by adults, or is it something that you're observing in children as well? And if you can, shed light on some of the most alarming trends that you have been observing with children.
Like I said, hormone imbalance, when we generalize to say hormone imbalance, we are talking about endocrine hormones. The endocrine hormones, like I said, they're all receptor dependent. Receptor dependent in the sense to be making it much more easily understandable. Imagine a black pen and a blue pen. They have black caps and blue caps. So you just remove the pens and the caps and then you just throw it in a pool of water. It is the responsibility of the hormone molecule to find its cap. So you need a coating on top of this molecule which goes and attaches to that cap so that it binds together. So this is what we call as hormone binding. And this binding is done by receptors. All these three things are individual things and independent things which is present in the blood. It's all there next to next. But unless and until it binds together, we'll not be able to get the effect of those hormones. That is why the imbalance is very common in endocrine problems. Endocrines are right from the first: pituitaries, the anterior pituitaries, posterior pituitaries, thyroid stimulatings, progesterone, estrogen, prolactins, insulin, glucagon, adrenalins. All these things are endocrine hormones. What happens is these hormones are in relationship with to the other hormone. So if one is getting deranged, then the other is easily getting deranged. So in order to bring that back, we have to struggle a lot in order to fix this, to come to the point where it was normal. It may sound very easy to understand, but imagine there are three different entities. They're all of different structures, different presentations, but it is the responsibility of yourself to bring all these three things together. You cannot do it. As a human, you can never put all these things to line.
So are you saying that more number of children, especially girls who are exposed to this hormone imbalance, will very early on develop problems like PCOD or PCOS?
PCOS is a hormone imbalance, actually, to say. Polycystic ovarian disease is a separate topic. We'll come to that in a minute. Why I'm talking about all these endocrine hormones is most of the diseases what you think are lifestyle, most of the diseases what you think are long-term medicated diseases like thyroid. If somebody comes back to you say I have a hypothyroidism, then probably you are about to take medicines for life. Diabetes, yes. And PCOD is becoming something like that. So these things are very difficult hormones to treat is because of this problem. So the more important thing is to make sure that they are not deranged. If at all there is an imbalance, like for example, if it comes to PCOD. PCOD is like PCOS is different from PCOD. When there is a syndrome, when there are when the disease or the signs and symptoms are pertaining to that organ and the relationship to that organ alone, we call it as a disease. But if it involves other organ systems, like if there is ovaries and insulin pancreas is involved, ovaries and thyroid is involved, then we would probably call it as a syndrome. And what happens with PCOD is very simple. See, every woman who has crossed puberty or menarche, there is a process where the ovaries and the uterus prepares the woman for pregnancy. The menstrual cycle is simple as that. It prepares the girl or the lady for pregnancy. If it doesn't happen in that month, then the endometrium shreds and then periods. So imagine what happens with the right ovaries and left ovaries. There is a fallopian tube and then the uterus and then endometrium. So what happens is the ovary is the one which gets stimulated by a follicle stimulating hormone, and then the follicle starts to come up. Follicle is the one which lodges the egg inside. So there can be few follicles in one ovary, and the follicle will start growing and it will become a developed follicle, and then finally about 14 days of the first half of the menstrual period, it becomes a developed follicle, and then it breaks on the 14th to 16th day to release the egg into the fallopian tube. This is the fertile period. This is where we call the fertile period. Till this, the endometrium is keeping a watch to see whether the egg is fertilized or not. If in this part of the time, if the egg is fertilized, then it has to have a place to come and lodge itself to grow into an embryo or a zygote or into a baby. So for this, thinking that this egg would be fertilized, the next 14 days, the endometrium becomes thickened by the help of estrogen and progesterone so that it becomes a nourishing environment for the egg, fertilized egg, to come and place itself so that it starts getting all the nutrients to grow into a baby. If fertilization doesn't happen, then the egg gets disintegrated, and then once it comes on the next 14 days, so 14 plus 14, 28th day, progesterone helps to shred all the endometrium which was accumulated in the form of periods. So this is the whole process. What happens is, instead of one follicle developing and then completely into a developed follicle, there are smaller follicles which comes here and there into the ovaries, and then it crumples the space inside the ovary so that one follicle is not allowed to grow into a developed follicle. So the egg is not coming out. Even though the girl gets a period, it's an anovulatory cycle. And once few cycles are an ovulatory cycle, the endometrium thinks that there is no egg, so why should I increase the endometrium? And it stops spreading the endometrium and the period stops. That's why we call it as amenorrhea. So these kind of symptoms comes up with young girls when there is a hormone imbalance. This hormone imbalance, if it stays there inside the reproductive organ, then we call it as PCOD disease. But if it associates with itself with the pituitary, with the posterior pituitary hormones, with thyroids, with insulin, we call it as syndromes. These things are very common nowadays is because of the lifestyle changes. Whatever holds good for the ovaries is same for the pancreas. If whatever you do for insulin resistance is the same thing which you're going to do for ovaries. At the same time, your waistline is one important parameter which every parent or every mother should think about their child. If the waistline is becoming bigger, the waistline is becoming more fatty, the waistline is becoming more thicker, then it's going to cause PCOD problems. So, however, the girl child is active, they bend around, they lift, they do all these chores, they go around, sit, stand, do sit-ups and all these lower body exercises. When they do, the hormone levels are maintained and the egg circulation and the egg flow is already maintained.
There is a concept of puppy fat, right? All children have excessive fat, and children have a belly.
Yes.
At what age should a child essentially stop having that belly? After what age? After the age of 8, we should be concerned about the belly, or after the age of 10, we should be concerned about the belly?
I would say the kids, we pamper the kids, we give them whatever they want, ice creams, food, sweets and everything. So probably till about 8 years, I would say. I would not extend it up to 10, but the maximum limit would be 8 years to watch out their weight. And after that, it is time to think about lifestyle changes, managements, exercises and all those things to put down the weight. So that would be the best ideal age for me. In case of women, I mean, girl child, male child, no difference at all. So that is the age when they actually evolve into an adolescent. So around 10 years, the maximum benchmark. But if we cross 10, then it's going to be really difficult for us, because hormones comes in. For both male and female, hormones starts flooding in, and it's going to be really difficult to manage all these things together. So probably at an early age, if the parents know what to give and when to give, and that'll be the best thing to do.
Speaking about hormones, I was speaking to a friend of mine who owns a kindergarten school. And during one assignment, the teacher gave a remark to the child saying she is very skilled at drawing or something on those lines. The parent came back and told that she has not decided that she's a she. How can you say she to her? You're supposed to say them. So this labeling seems to be a thing. And my son is now in grade 10. I hear very often about how children have to label themselves today as they, them, he, she, it. And I don't know. I mean, while I want to be, it is important to be respectful about, gender appropriation and gender identification. I wonder if just to be a part of an ecosystem, or just to be a part of in vogue, is something going wrong with, and our parents also fueling this?
This is a very difficult topic to discuss. Is because of the representation what one might get from the society. Let's be very open on this topic. Is because this is the need of the hour, that identity crises are there everywhere in the world.
And all of these things, it leads to ingesting hormones. If I mean, that's so dangerous. I mean, even with a healthy lifestyle, it's so difficult to grapple with hormone changes.
Exactly. No, now even doctors are very scared, like what I hear from, that if somebody comes back and says, no, I want to become a he, if it or they is a she, and if they want to become a he, and see how difficult it is even to frame a sentence. If they want to become, if they were the she and if she wants to become a he, then doctors are very scared and to say no to that. When is the decision making right age for them to make a decision on their gender is still a question mark. I would personally say, if you ask me, there are genders. Yes, there is a male, there is a female, and there is a non-male, non-female gender. I would call it very neutrally that there is a male gender, there is a female gender, and there is another gender which is not quantified as a male and also not quantified as a female. That's it. There is no calling them as they, it, that, and we call it and they for non-living things or living things which has very less IQ or five senses or six senses. What happened is, I'll tell you my personal experience is like when I was recently in Australia, where in my radiology clinic, I had to do a scan. So the patient walks in, and obviously it looked like a male. All the haircuts and the way they dressed and everything was fantastic. And then they introduced me as so and so. I just greeted them and then asked them to lie down on the table. And when I saw the request, it was given to evaluate the ovaries and uterus. As a doctor from Indian origin, what am I supposed to understand? When you see a male patient and the doctor has given an evaluation to do the ovaries and uterus, obviously it was a confusing thought for me for a second, which actually annoyed the patient. And then I got my senses back and I understood it's a problem. And then I asked, how do you want yourself to be greeted? This was the first question that everybody thought is when you go out of India, when you go to practice, this is a big deal. So whenever I went there, so I asked that person immediately, how do you want yourself to be greeted? And that's when I understood it. The person was around 18, 19 when they infused all this testosterone hormones to become a male. She was born as a female and then wanted to become a male. The amount of dilemma, the amount of confusion what that person had in mind was very evident, that I could empathize on them to see how transition difficulty they are going through. If my kid or any of my friends' kid is going through that transition, I would want them to do it when they are adult, or I would say at least 18, 20 years to know that what they are doing. I wouldn't say my 5-year-old or 6-year-old to go and decide that I want to become a male, I want to become a female. That's absurd, that's nonsense. Even if it is against the law, even if it is against the society, or even if some part of the society is offended, I wouldn't let my kid or any kid for that matter to decide on their gender at a very young age. I'm very openly telling this could be a very controversial discussion, but this is the fact. They have time to decide what they want to become. If you are ready to give them a responsibility to find out who is going to govern them, then you should give them that equal time duration for them to get matured, at least to a certain extent, to decide whether they want to be called she or he or they or them. If there is a hormonal imbalance, yes, that's a different question. If there is, rather than hormonal imbalance, if there is a chromosomal abnormalities, which gives you a gender where you have rudimentary or underdeveloped male characteristics, but you are presenting as a female, or if you are having underdeveloped female characteristics and you are presenting as a male, that's a different story. We call them as a third gender. Problem solved there, that's it. But if gender A wants to become gender B at a very young age and then they infuse hormones to become that, then that is identity crisis. This identity crisis has to be solved inside the family. It's not an environmental issue. It's not a society issue. It should be solved inside the family. So if I should be able to talk to my kid to make them understand that there is still time to decide when you have to become what, then be it.
So what you're saying, doctor, is essentially that everybody has a right to choose their identity, but it has to be done as an adult. Yes. With full understanding of the implications of that in their life, and exactly. Not a decision to be taken by a parent.
Yes, no, it's not a decision to be taken by a parent. It's not a decision to be taken by themselves at a very, very young age or a tender age. We would say, would we give them a decision to decide who is going to rule us when they are 12 years, 13 years? So how would you be very confident enough to make them decide what they want to become when they are 12, 13 years? That is an emotional turmoil there. That is a roller coaster change of hormones flushing into their system. They do all sorts of nonsense. They're all crazy things. Like every teenage, we were teenagers, we did all these nonsense. But when we evolve, we understand, okay, this is going to be my identity. This is going to be my gender. This has a time to decide, and it is the responsibility of the society to give that time. Rather than jumping into parents saying that they should call their kid they, them, that, it, then they have a problem, they have to go and consult a doctor. It's not the kid who has to do it. If the drawing teacher marks she did a fantastic job, she did a fantastic job. Because as a third person, I see you as a she. If you are a they, then let her become 18, 20, 21, 25 to come back and say, I'm they, I'm not she, not the mother or the father. So if the father or the mother wants to decide the identity of the kid, then be it with their opinion, they do not bring it out to the kid or to the third person.
Amazing, doctor. It was so enlightening to hear this, and I hope to meet you soon on the next episode to discuss more exciting topics like this.
Thank you very much, and we have so much interesting topics in health and wellness. We'll be happy to continue. Thank you very much.